Many people are likely taking too little vitamin D, and this is based on research suggesting that, on a typical sunny day, our skin can produce up to 25,000 international units of vitamin D. Compare this to the current UK government recommendation of just 400 international units per day, which seems quite low. This idea is supported by solid evidence, which we'll explore in this video. By the end, we'll ask why health authorities aren't aligning their recommendations with the latest research. We are supposed to base medical recommendations on evidence, but are we truly keeping up with the science? It's worth questioning whether certain policies need updating in light of new findings. To understand why current recommendations might be outdated, we need to look at the economics and history of vitamin D. Over the years, various industries have influenced public health policies, sometimes prioritizing profit over science. We'll examine how historical events and economic interests have shaped the guidelines we follow today. By understanding this context, we can better advocate for recommendations that truly reflect the latest scientific research. Vitamin D is a relatively inexpensive supplement, and because there's no patent on it, big pharmaceutical companies can't profit massively from it. Some of you might have pointed out that vitamin D supplements can be expensive. While it's true that certain suppliers might mark up the price, if there were more competition, prices could drop. Since vitamin D isn't patented, manufacturers could produce it in large quantities, lowering costs as demand grows, especially once its health benefits become undeniable. Let's dive into the research now. The original study we're discussing is fascinating. It provides historical context, such as the early 20th century discoveries about vitamin D's role in treating conditions like tuberculosis, psoriasis, and rheumatoid arthritis. Back then, they used very high doses, sometimes 10 times the current recommendations, which led to concerns about the safety of large doses. As a result, recommendations were reduced to much smaller doses. Stick with me, because this research is crucial. The study looked at daily oral doses of vitamin D3, ranging from 5,000 to 50,000 IU for hospitalized patients, particularly those in psychiatric care. It's an interesting sample because the researchers could monitor and adjust vitamin D levels in these patients. This was a robust, peer-reviewed study published in a reputable journal. The study was conducted in Dayton and Cincinnati, Ohio. Vitamin D is produced in the skin in response to sunlight. However, many people don't get enough sun exposure, leading to widespread deficiency. This deficiency can have various health implications, so it's important to be aware of our vitamin D levels. Vitamin D is considered a hormone that our bodies produce in response to sunlight, with estimates suggesting we can produce up to 25,000 IU per day if we're spending time outside. This amount is far higher than many people assume. If we were living in a more natural outdoor lifestyle like our ancestors or agricultural workers, we'd be producing much more vitamin D than most people today. Vitamin D deficiency is common and linked to several health conditions, such as autoimmune diseases, heart disease, multiple sclerosis, and certain cancers, including colon, prostate, and breast cancer. We've looked at studies on this before, and the evidence is clear. Vitamin D is essential for maintaining good health and preventing disease. In the past, some diseases dramatically improved with exposure to sunlight, which was used to treat tuberculosis, for example. Personal experiences and study results reveal a lot about the impact of vitamin D on our health. The research suggests that supplements are also effective for conditions like asthma, psoriasis, and rheumatoid arthritis. I've cared for patients with severe rheumatoid arthritis, watching them suffer with painful, deformed joints. It's heartbreaking that high doses of vitamin D could have alleviated their pain, but we didn't know about it at the time. This is not ancient history. This was just a few years ago, which makes it even more frustrating that patients didn't receive this simple, cheap, and effective treatment. The study showed that from 2011 to 2018, 4,700 patients were admitted to a psychiatric hospital and screened for vitamin D deficiency. Most agreed to supplement with vitamin D, and they were given doses ranging from 5,000 to 50,000 IU daily. Compare this to the UK's recommendation of just 400 IU per day. Our guidelines seem laughably low. Many patients took 5,000 to 10,000 IU daily, with some needing 20,000 to 50,000 IU for specific diseases like psoriasis and rheumatoid arthritis. Importantly, there were no cases of vitamin D toxicity or hypercalcemia reported, which is a common concern for people worried about taking high doses of vitamin D. Even those taking up to 50,000 IU daily showed no adverse effects. This highlights how safe high doses can be when properly monitored. In this study, patients who took vitamin D3 supplements had significantly higher blood levels of vitamin D compared to those who didn't. For example, patients on vitamin D had an average blood level of 118.9 nanograms per milliliter, while those who weren't taking it had just 27.1 nanograms per milliliter. Interestingly, their calcium levels were nearly identical, suggesting no risk of harm despite the high doses. The study concluded that long-term supplementation with vitamin D3, ranging from 5,000 to 50,000 IU per day, is safe and well tolerated. They noted that patients' vitamin D levels continued to rise for up to a year before plateauing. Long-term supplementation of vitamin D has been a topic of much debate. The current guidelines suggest a safe upper limit to avoid toxicity, but ongoing studies are re-evaluating these recommendations. It's essential to understand how these limits impact our health over extended periods. After 16 months, patients on 10,000 IU per day had blood levels of 96 ng/ml, still within the safe range of 30 to 100 ng/mml, as recommended by experts. The current upper limit for vitamin D is considered to be 100 ng/ml, but given that we're naturally capable of producing 25,000 IU of vitamin D from sunlight, it's worth asking whether this limit needs to be reconsidered. In this section, we delve into the intricate relationship between Big Pharma and personal dosage recommendations for vitamin D. Understanding. This dynamic is key to grasping why certain health guidelines may not be as up-to-date as they should be. So why aren't health authorities updating their recommendations based on evidence like this? The simple answer is that Big Pharma can't make money from vitamin D supplements, which is likely why there's no push for widespread change. But improving public health should be the priority, not corporate interests. I take 8,000 IU of vitamin D per day combined with 200 micrograms of vitamin K2, but I can't tell you what dosage is right for you. Always consult with your doctor before making changes to your supplementation. In conclusion, it's evident that vitamin D plays a crucial role in our overall health. The evidence we've discussed highlights the need for updated guidelines. So, if you haven't already, consider getting your vitamin D levels checked, and talk to your healthcare provider about the best ways to maintain adequate levels. The bottom line is that the current vitamin D recommendations are likely too low. Authorities around the world should consider revising their guidelines based on the latest evidence, such as the studies we've discussed here. It's time to move past outdated advice and focus on improving health with proven, safe, and affordable interventions like vitamin D. Thanks for watching, and I encourage you to read the full research for more insights into how we got here. Let's hope that those in charge start listening to the latest evidence and update their recommendations accordingly.